approach, you might say, to help hurricane victims in Puerto Rico. An eye doctor in the South Bronx collects eyeglasses for people on the island. How great is that? He's currently working on ways to help those with severe vision loss. We'll hear how in just a minute. But the doctor and his staff are heading to the island to hand deliver the eyeglasses. And here with us this morning, ophthalmologist David Alevi and Wilma Burgos. Welcome to you both.
Well, thank you very much.
Where's the office?
So it's on 161st and Grand Concourse.
Okay.
860 Grand Concourse.
Only been there a year or so?
Only been there a year.
Why'd you set up shop there?
I like the people. There's a sense of community. You know, I'm an immigrant as well, so I kind of feel like we have something in common, and it's just really nice. People have been welcoming, giving food, like learning the culture, so it's been nice.
And I bet your Spanish has picked up.
Hablo español, no problema.
Okay, muy bien. But what have you been hearing since the storm from your clientele, which I'm guessing is largely Dominican, Puerto Rican?
Yeah, mainly Puerto Rican and Dominicans.
Yeah.
It's been sad. It's been really hard for them to get glasses. It's been very expensive. You know, when I do cataract surgery on a patient, they'll come back, they'll say, can you give me some frames to give to my family in Puerto Rico? Mm-hmm. So that's how kind of the initiative started.
Okay, and then Wilma, you and your daughter, right?
Yeah.
Made this, took off?
Yeah.
Share the connection between the two of you. Your daughter works in his
office,
okay.
And he gave me the chance to talk to him about my project because I have a sister-in-law who's suffering cancer.
Mm-hmm.
She's having vision problems.
Okay.
The costs are really expensive.
Mm-hmm.
So came to Doc said no problem, and here we are.
Okay. What's the goal? How does it work?
The goal is to get these lenses down there and get someone to help us make the lens for them at no cost to them.
Okay.
So that we can have their vision. They're changing the next 3 months, 6 months.
Mm-hmm.
We have the glasses.
Pero tiene familia en Puerto Rico?
I have plenty of family.
Okay.
I have brothers and sisters out there. I have cousins, uncles.
How many pairs of eyeglasses have you collected?
So far, we've got about 100.
Okay, and when did you start collecting?
This week.
This week? Okay. And if all goes well, you're going to Puerto Rico cuando? When?
January.
Mid-January.
January.
So
you're going to take the glasses with you?
taking the glasses with us. We're trying to make a clinic as well, trying to see as much as we can do to help. I'm going to give some lectures, just really try to kind of spread the word. Unfortunately, we see a lot of people come from Puerto Rico with bad cataracts, bad eye issues,
right.
And we treat them here. So we're trying to kind of spread the word that we're here to help.
But Doc, your patients have been lamenting to you that finding quality eye care on the island has become problematic. What's the issue?
I think there's just a lack of resources. I think with the hurricane going on, depending on the city, I think San Juan luckily has been well funded, but we're going to be working in Ponce, and I think Ponce has been severely underfunded.
Yep.
And it's just sad to see kind of the care some of these patients have had.
What are the stories that you're hearing and your daughter that are hearing from patients?
Plenty, you know, they can't get the money to get it, but there's no resources, there's no jobs. So if there's no jobs, they can't get medicine. If they can't get medicine, they can't get eyewear.
But in terms of the doctors or not following?
Very lack of doctors. There's not.
No. Se fueron.
No, but Walmart might have a lens crafter.
Okay.
That's it.
That's about it.
That's about it. And I've seen this myself.
But if you need something that's a little bit more surgical, if you will, cataracts, glaucoma, you need to find someone with expertise, and finding that on the island is difficult.
It's very tough. So a lot of them, you know, if they have relatives in New York, they'll come to us, and you know, right away they've been here in the country for a day or two. They'll come to my office. A lot of time you see that's an advanced cataract or an advanced glaucoma, and you're playing catch up. So we're trying to catch them before that even happens.
Is there opportunity, Doc, when you go to the island, that you yourself will be able to, I don't know, perform surgery or point some people in the right direction, or take it the next level, if you will?
That's what we're trying to work on now.
Okay.
Unfortunately, the machines are very expensive, and just the staff. You need trained nurses. You need trained staff in all aspects of it to kind of make the surgery. I think we take for granted in the U.S. how much resources we do have, so we're trying to just give back to the community.
Wilma, ayúdame, how can a pair of glasses, donated glasses, help people in Puerto Rico? I mean,
oh my gosh, of course.
It's the frames,
Someone
right?
who lives in a mountain that doesn't have money comes down and you give them a free pair of glasses, they're happy. They can see.
But matching prescriptions is a shot in the dark.
True,
So,
which is why we're working to see if we find someone to help us down there to give them vision as well.
okay, so even if they don't have the prescription that'll work for them,
Right.
take the glasses,
Right.
you've got the frames,
Right.
and now get new lenses.
Now we're cutting the cost for them.
How much have you saved by?
I'm going to say $200.
Really?
Yeah.
That's how much frames are going for?
Pretty much.
Okay. Are you at the point where you can reach out to, what would it be, the manufacturers of lenses to say, Papi, ayúdame, help out?
En eso estamos.
Okay.
Ese es el próximo proyecto.
Okay.
Buscar a alguien que nos ayude a poner poner los lentes.
Do you have
No
someone
cost
that you work with in terms of
We do.
providing low-cost lenses?
We do. I mean, now that we've seen the response, we've just been so happy at how many people have donated frames. Now we're working on just expanding it. Initially, it was just to get frames, and it was a small project to help people we knew. But once we saw the response, we realized we can do so much more with it.
How much does it cost to get a new? I know it varies from lenses to lenses and depending on the prescription. But what's the gamut of costs in terms of getting a set of replacement lenses in your donated glasses?
Yeah. So unfortunately, there's progressives, bifocals, single vision. Single vision usually runs about $20 to $25. Progressives and bifocals can go up from there. But we're trying to see with a wholesaler if they'll be willing to give us the price at cost,
Right.
and then we can go from there. So I mean, it's really just been exciting to see how much this has grown, and we're just going to take it as far as we can take it.
All right, sit tight. A few more questions for you when we come back. More on the donation of eyeglasses for Puerto Rico and where you can take some if you have them to get them donated so they'll make it to the island. Still ahead on Tiempo. Speaking of Puerto Rico, Lin-Manuel Miranda helps make a special announcement to help boost. Welcome back to Tiempo, a unique approach to help hurricane victims in Puerto Rico. An eye doctor in the South Bronx collects glasses for people on the island, and he says some of his patients have really talked about the hardships of getting good eye care in many parts of Puerto Rico. The doctors have left, so many of them. He's currently working on a way to help those with severe vision loss. And joining us this morning, ophthalmologist David Alevi and Wilma Burgos. Her daughter works in his office, and together they've teamed up to make this happen. An Israeli doctor in the South Bronx who speaks Spanish. Que bueno. You don't find that too often, right?
Not too often, but
you find the cultures are largely the same, isn't it?
very similar.
Yeah,
It's kind of nice. You can be open, you can talk, nobody gets offended. It's kind of a nice feeling. I really enjoy talking to my patients.
This is the way it is, for sure. When is the hope to go to Puerto Rico with the glasses?
So the hope is to go in mid-January.
Okay.
That's the hope. We've been organizing everything, and the date is probably going to be around mid-January.
And I know you want to go to Ponce.
Yes.
I mean, say you have 400 glasses to distribute. Are you going just to Ponce, or are you going to try and hit a few places?
We'll do a few towns.
Okay.
We have a few towns in the surrounding area of Ponce, like Juanadilla. We've got Isabela, so we can go there as well, but we still need to find a place to distribute.
Okay. Well, hopefully your appearance here will open a few doors so that you can arrange it and say, mira, come to Rincon.
Dame tu lente pa tu gente.
Okay.
That's the way it
There we
is.
go. I know that part of the issue with so many Latino, Puerto Ricans, Dominicans who have diabetes, which is so big in the community, and one of the adverse effects of diabetes is deteriorating eyes, correct? So how often do you spend your time encouraging, especially Latino patients, come in and get checked?
It's a large portion of the practice. Just because if they can come in, we can prevent so much. So diabetes, glaucoma, cataracts, these are things that are easily fixed if we can find them earlier rather than later. So we spend a lot of time just follow up with your appointments. Just come in. It's an easy exam. You're not going to wait long, but it can really make a difference in the future.
Because you want to get ahead of the curve, do you not?
Always want to get to the head of the curve,
Okay.
yes.
What's the fear? What's the hesitation for so many patients?
I think unfortunately some people get really, they've waited long in the waiting room. They feel like nobody cares. And I think that's a part of me why I wanted to be in the South Bronx. I really feel like when someone sees that you care, they really are happy about it, and they're really appreciative that you're really there to help them.
But what's the fear or hesitation, Wilma, before they get to the doctor's office that prevents them from even going to the doctor's office? I'm guessing part of it is
Money,
is plata.
insurance, dinero,
Yeah.
de no tener.
And if it means getting glasses or putting food on the table, guess
They're
what?
going to get food on the
They're
table.
going to get food on the table.
Yes.
But from a long-term health perspective, getting in front of this is what's important, correct?
Yeah, and that's why we take all insurances. We've been really trying to help people even if they don't have insurance. We just want people to come into the door so we can help them out.
I want to put up your address one more time so that if people are watching and saying, listen, I've got old pairs of glasses in my drawer, I want to bring them. Here you go. You can donate. South Bronx Eyes is the name of the business, located at 860 Grand Concourse, Suite 1N. Wilma's daughter will be there to greet you, and Wilma might be there too. There's the phone number if you want more information, but feel free, right, Doc? Come by.
Come back even just to chat.
Just to chat.
Just
Bring your glasses, and you got a box there? What?
Absolutely, we got a box. We got quite a few boxes.
Well, I'm hoping now that you got a bigger box because I'm hoping that people will come for you to deliver.
Yes,
Thank you for doing what you're doing.
Thank
Okay?
you.
Y buena suerte, and let me know how it goes in January. okay?
Absolutely.
All right. Before we